I feel like as an ophthalmologist, we, being in the ophthalmology field, especially in the retina field, artificial intelligence seems to have been incorporated in our vocabulary for over 10 years because there have been significant moves or shifts, Google Mind, DeepMind, all these things that we've been hearing about for a long time. And I think based on those news articles and what the media said and some of the talks and so on, one would think we'll be further along now than we are, certainly in ophthalmology and specifically in retina. I would say that there are some areas where there's readiness. So there's elements of diabetic retinopathy screening, for instance, where AI has been utilized, I think, in parts of the Scottish program and in other parts of the world, for instance. When I go to work and I turn on my computer and it takes me 5 minutes for it to boot up, for me to upload the first, but AI is the last thing on my mind, frankly. I'm just trying to, use the very basic digital tools that we still have to get the work done. So I think that whilst AI holds a lot of promise, and I think the promise in retina, in ophthalmology is mind-blowing, and particularly for something like retina where a lot of what we do is pattern recognition, multimodal imaging and synthesizing information in that way, I think AI can be a very useful ally. However, where we are now on ground right now, if you were to ask me on a scale of 1 to 10, are we AI ready in the NHS? In retina, I can't speak for the whole country. In retina, I would say the infrastructure at the moment is about 2, maybe 3 out of 10. We're not even, and as you rightly said earlier, there are pockets of excellence, but there are areas, there's still units in the country that don't have electronic health records. There's still units in eyes. There's still units in the country that can't remotely view retinal images. Still units in the country where the optometrist has to send screenshots of an image because their imaging and ours is not interoperable. We're talking really basic things before we get into AI being able to improve our workflow or even do a first pass on diagnosis. Very nice, very possible. And I think there's already loads of proof of concept. But in terms of where we are on ground right now, I'd say we're 3 out of 10. And maybe from my little pocket of Northwest London, but very much we're nowhere near.
I couldn't agree more. And in fact, even within the islands of excellence, putting up your PC takes maybe as long or longer than anywhere else. So there is this disconnect, as you described.
Correct.
But we could flip it around as well and, of course, ask whether AI is ready for the NHS, but whether the NHS is ready for AI. And what would that mean? Mm-hmm. What mental image do you have, if I could put it that way, of an AI-enabled
NHS
clinical service, an eye care service?
Yeah. So one of my roles, as you rightly mentioned earlier, the research director for my trust, and I get to, one of the benefits of that is you get to sit in some conversations, be on eyes. And so I get to see how other specialties are contemplating piloting AI and some of the concerns that have come up around de-skilling, for instance, in some areas where maybe they're trying to use AI to support discharge summaries or errors that happen because people don't cross-check things because they take what the AI has provided as, gospel, amongst those other things. And then there's also sometimes the difficulty finding a balance between piloting something and being extremely risk averse such that you don't even try it because there's some other areas where, they're full speed piloting things. They're like, listen, let's go for gold because this could be something. And yes, we need to mitigate some risk, but we can't be so afraid that we let perfect be the enemy of good and do nothing, right? And then there's other parts of the NHS where I've seen where we're so risk averse, it's like until we get the golden yes that this thing is fully safe, we do nothing, right? So I think an NHS that is ready for AI really needs to be, from a clinical perspective, where clinical AI interpretation is some sort of core competency, right? Not that we all need to be the next Konstantinos who's the AI god. No, not at all. But at least you need to know what AI can do, what it can't do, be able to spot when you can trust what it says and when you can't, be able to understand the basics of the system. Is it rules-based, statistics-based? Those, just understand, almost like how you would interpret a lab test. I'm not a bio, chemist in the labs or anything, but I see a readout of a full blood count and I'm able to interpret whether this is within range, not normal. So I think every clinician needs to be part of our competencies now. This ability to assess, critically appraise AI output with regards to clinical information, that I think needs to be part of our core competency as within the NHS. But even where we have the governance frameworks to be able to pilot things without being too risk averse. Where you can have mitigators for perceived risks, and where you can set metrics or key performance indicators and say it meets this threshold, it is safe to deploy, and this is how we will monitor going forward. Something like that. I think until we have those sort of systems in place, we will always have pockets of excellence and areas where nothing is happening, and also a lot of people just being very uncomfortable or unable to function in a system where AI is now essentially an ally or a tool, one of our tools that we use as clinicians.